Welcome to the Elevating La Cultura podcast, a space where I talk with Latinas who are passionate about what they do and are willing to share that passion with others to change the narrative, especially for the next generation. Each season is centered around different topics, but all with the Latina perspective. Welcome as we continue with season 12 with a focus on women's health. It's going to be a great season, so let's get into it. Dr. Mae Lynn Reyes-Rodríguez is a clinical psychologist and associate director of Inpatient Psychological Services at the UNC School of Medicine. Her professional goals are focused and straightforward. Make mental health care fit women's real lives by closing cultural, linguistic, and access gaps. A former NIMH postdoctoral fellow who adapted cognitive behavioral therapy for Latinas, she now brings that same precision to perinatal mental health as a co-investigator on the MomGenes study. She's committed to practical evidence-based tools for all mothers while offering a deep bilingual understanding of Latina and immigrant families. She hopes to expand bilingual screening and education, reduce stigma around postpartum depression, and train clinicians to deliver culturally relevant care across communities. Please enjoy our conversation. Hi, I am so excited to be speaking with Dr. Mae Lynn, and she is going to be our final guest for this season, and this conversation is going to be much needed, I think, especially in the times that we're at now, and I can't wait to get into it. But before we get started, why don't you go ahead and introduce yourself?
First of all, good morning and thank you for the invitation. I'm Dr. Mae Lynn Reyes-Rodríguez. I am clinical psychologist, clinical professor at the University of North Carolina, Chapel Hill in the psychiatry department. And also I do research, primarily doing cultural adaptation for eating disorder, for postpartum depression, anxiety, all of these issues that are very common in our Latino community.
How did you get started in this profession? I think there's a lot more talk right now, especially in our communities, in the Latino community, about all of these issues, postpartum anxiety, depression. But how did you get into wanting to study this to where you are now?
Yeah, I think that my first interest was eating disorder many years ago, about plus 25 years. And also we know that in women we experience not only depression and anxiety, but also eating disorder and comorbidities. So when I started studying eating disorder, also I see like postpartum depression on some of our eating disorder patients. So more recently, was prior pandemic that I was approached to start doing cultural adaptation about behavior activation for postpartum depression, particularly in the Latino community. And that was like the beginning to just focus more on postpartum depression and perinatal depression.
When I was growing up, there was no talk of depression or any disorders or anxiety. And I'm grateful to have that conversation more prevalent in our day-to-day, especially as I'm raising kids. I know that when I had my second, that's the first time someone asked me, like, how are you feeling? And that's when I started my anxiety and depression meds. And it was something that I didn't even know to look out for or to even think of. I remember when I was being asked the questions and I was like, isn't this normal? Isn't this like a normal feeling? So I'd love to know, where does postpartum depression overlap with anxiety and disordered eating and all of that? Like, how did you tie all of that into what you're studying?
Yeah, first I think that especially in our culture, in the Latino culture, we tend to glorify maternity, and it's like should be like a happy moment for us. So sometimes just like thinking about the possibility of having sadness, depression, anxiety feels like the opposite of maternity. And I think that it's important first to normalize that can happen, and there's nothing wrong with you as a woman, as a mom, to experience depression or anxiety. We have, for example, like usually because of the hormone, we can experience like what we call the blues, which is the first few weeks that we feel this low of energy and mood. And if those symptoms continue more than 2 weeks, then we are thinking about depression or anxiety. I think that it is important to identify what are the symptoms that I am experiencing in if I feel like sad, if I feel like having difficulty sleeping, which is normal during the having a baby, not sleeping because the baby need to be taken care of, but also if you have those kind of issue with sleeping, concentrating, or having some thought about harming yourself or doing something bad to your baby, I think that it's important to start like thinking about maybe I have depression related with my pregnancy. That could be postpartum depression, or if it is during the pregnancy, can be perinatal depression. And sometimes depression and anxiety can coexist, so you can have the depression and also the anxiety piece.
I didn't even know you could have like, I think you called it something where you're depressed during pregnancy. How is that different? Is it different than postpartum depression? And what are the signs that we should be looking for, like during our pregnancy? I think we only hear a lot about postpartum, at least now. Yeah, so I'd love for you to talk more about that.
Yeah, when we are in the pregnancy and we are experiencing the feeling of sadness or feeling guilt or worthlessness during the pregnancy period, then we can talk about perinatal depression. And some women can feel like okay during the pregnancy and having like a normal pregnancy or happy pregnancy, and then after giving birth they feel all of this sadness and symptom associated more with depression and anxiety. That's basically is the difference. If it's happening during the pregnancy versus it's happening after giving birth. It could be both.
Like you said, like we have this idea in our head that everything should be happy and perfect and like throughout the whole time that we're pregnant and even after. But is there something that we can be doing, like um, nourishing our hormones or like just paying attention to our hormones? Because like pregnancy, like we only think of like, oh, we're growing a life inside and then now it's out. There's not a lot of like time that we are thinking about ourselves and what is actually going on in our body and the hormones that are fluctuating, especially if we like are breastfeeding as well. So I'd love a little bit more knowledge or expertise on the hormone level that we as women go through during this whole process.
Yeah, and yes, for sure, there is some hormone changes. And also, it is important to acknowledge that postpartum depression or perinatal depression is a combination of genetic. There is like genetic component plus the environmental factors. So we can have in our genes the predisposition to develop the perinatal depression or postpartum depression, and if that is combined with some environmental process of factors, stressors, that create that I call like the perfect storm, and then you develop the mental health condition. So I think that part of the process is first identifying if you are at risk. Sometimes just like looking into your family history, if your mom, if your grandmoms have suffered from perinatal depression, maybe you are more at risk. And also that's the path, the piece that you don't have that much control, right? But then there is some environmental factors that are more under your control, in the sense that you can try to identify what are those stressors that you have and how you can try to tackle those. It could be financial, it could be immigration process, it could be domestic violence. It could be many factors that it is important to identify if you have one of them and trying to take care of yourself. I think that that's the other piece that is important.
Yeah. How do, because like you said, like let's look into our family history, but a lot of times our families might not want to talk about that or say anything or deny that they have suffered or like have gone through depressive episodes. So how do culture and language and stigma affect us like wanting to seek help? And how can we like close those gaps?
Yeah, I think that doing this, what we are doing today, this kind of podcast, raising awareness that this is happening in our Latino community is normal, and it is okay to talk about postpartum depression, perinatal depression. There is nothing wrong with you as a woman. I think that this is the first step. It's psychoeducation, is raising awareness and having this conversation to normalize that it is okay to talk about it. We know that as community, there is like a huge stigma about mental health. We don't want to talk about any kind of mental health issue because we don't want people to think that we are crazy, that we are loco, which is the term that we use in Spanish, that it feels like almost like we can't talk about it. And I think that raising that awareness would be very important. And thank you for doing this kind of program, because I think that educating our community is the first step.
Yeah, for sure. And I think that like just knowing about this, there is a growing need for people and representation in the healthcare system that are bilingual, bicultural, because I know as I've talked to people, there's this anxiousness when talking to doctors and people in the healthcare system because they feel like, oh, well, maybe they won't believe me, or like maybe they will say that, oh, it's nothing. And yeah, I just think that there needs to be more representation. So how can bilingual or bicultural clinicians, like what can they do differently right now to help get rid of this stigma around this topic?
Yeah, as I said before, psychoeducation is powerful. I think that when we as clinicians, we assess those symptoms, even sometimes the presentation, the patient maybe do not present in a way that you feel like, oh, it has like perinatal depression. But sometimes it's because we don't ask, we don't like dig into really provide a safe space for the patient to feel that it is okay to talk about it. So sometimes when we provide that safe space and ask the right questions to them, we can really get like an honest, open response, and that can help us to continue providing more psychoeducation treatment. So I think that it is important to assess. Sometimes even if the patient is not presenting symptoms, just like explore and do the screening and see if qualify for perinatal postpartum depression.
I remember when I was doing my postpartum screening with my OB/GYN or my midwife, and she was asking me questions, and I was kind of like, as a Latina, I deal with things that are, or I used to deal with things that are uncomfortable with humor. And so I was answering the questions, honestly, but also I was like, haha, yeah, I feel sad all the time. Like, but doesn't that anyone? And I really appreciated that she took it seriously and was like, you know what, let's ask, I'm going to ask you a few more questions and let's assess. And that's when I started taking it seriously. So I do agree that providing that safe space and having conversations where we normalize this more is really going to help the future moms to get the help that they need, especially because if we're not okay, we can't like make sure everyone else is okay. We need to make sure that we're okay first. I know that you're doing and working on a study. I'd love to know more about the study that you're working on.
Yes, so we are working on the study MomGenes. This is a study that we want to add more data from the Latino community to understand better what is the genetic component and also the environmental stressor that Latinas experience during the pregnancy and postpartum process. So years ago, in 2016, there was like a first part of the MomGenes study, and most of the sample that they collected was from European ancestry. So that's one of the issues that we are finding, that many of the research usually have information from European sample. So we are not represented in those studies. And our genes are not the same, right? There is some slight differences across populations. So it is important to have representation from our community and our experiences as immigrants are very different from Caucasians, from Europeans, from other communities. So I think that the intention of MomGenes is a study that want to explore more the genetic components and also the environmental factors affecting the Latina community. So we are recruiting Latinas who have any experience at some point in their lives with perinatal depression or postpartum depression. We also are like gathering information from moms who haven't suffered from those conditions, because we want to have a compare group. But the intention is to gather more sample from the Latinas community so we can have a better understanding, eventually improving treatment, because we wanted to tackle our community, providing the best care possible, and also prevention.
So what is the age group that you're looking for? Is there an age group?
Is 18 and above. So.
Okay, and how can people get connected to helping you with this study?
Yeah, so we have a website. I think that would be important to connect with our website as MomGenes Fight, ppb.org. And in our website, we have all of the information about the survey that you have to take, so we can see if you qualify. If you qualify for the study, you have to complete like a consent forms, and there is other questionnaires that the patient has to complete or participant. And if qualified, we send like a blood kits, because we wanted to collect like a small blood sample. Is using a kit that the patient will have at home. So the participant, they don't have to go any place. At home, they can collect the sample, and then they, after collecting the sample, which is like a very small, is like less than a teaspoon sample, they return the sample to our UNC site, and then we analyze the sample, and that's the very, very easy process. And there is a small incentive if the patient or the participant qualify, that the patient will receive some $35 as an incentive in a gift card.
Okay. And so, like for me, I had my kids a long time ago. My youngest is 12. And so would I still be able to like, should I look into it?
Yeah, of course. It's not that the participant need to have the experience at the moment of participating in the study. It's that at some point in their life they experience those symptoms, and what is important is to navigate through the survey, and the survey will let you know if you qualify or not.
Okay. And then as you're conducting this research, how will MomGenes improve like the risk identification and the support for our communities?
I think that the first step is like creating this awareness. I think that this is the first step. We want the community to feel comfortable identifying, yes, I have an issue, and there is some help. So those patients or participant who feels that they have like postpartum depression, there is some resources that we have available in our websites. Usually in the main setting of university, they have usually women clinic that treat postpartum depression, but there is many resources that the participant can identify in our website. So I think that combining of creating the awareness of postpartum depression and perinatal depression in this community, in the Latino community, and also collecting the blood sample, I think that in the future we can have a better understanding. And you as a mom, even when you have suffered from this condition, you can help another mom to have a better understanding. In the future, our hope is to be able to understand better the condition and develop more treatment that fit more for our community, and also preventing programs.
And what myths can you share about postpartum depression? I think like for those of us who like only see or hear about these symptoms like on the media, in television shows, sometimes it can be like jarring, or like we might not even know that we're experiencing this because we don't know what to look for. So are there any myths that you can bust for us about postpartum depression?
I think that what is important is that can happen to anyone. So I think that yes, being pregnant, having a baby, there is so many like gratification about that, but also we can experience sadness even when we feel like the blessing of having a baby, and there is no contradiction about that. I think that in the Latino community is the prevalence is higher. It's almost like 3 times compared to the European or white population. So I think that is happening in our community. It's more frequent than we think, and there is some help, and you can feel better.
I think about like our communities, we're very community centered. Like we want to be able to help. And a lot of times we're so focused, we might be focused just on the baby and not as a family unit as a whole. So how can partners and family like do to help the process as a new mom?
Yeah, I think that if you, as a partner or as a friend, you see someone that you love who could present some symptoms of sadness, or you feel that it's a little bit off, just like ask how you can support her. Sometimes also encouraging to seek professional help. If you're a partner, you can go with her to the PCP or OBG clinic and just share your concern. And continue providing support. Sometimes it's practical support because we need someone else also to help us to take care of the baby. But also if there is another person taking care of the baby, that can help me to maybe sleep a little bit more, maybe taking a longer shower, eating like without feeling rushed because I have to feed my baby. So there is many ways that you can provide support. So I think that is don't be silent. Share your concern, and you can say, I have concern about you. Is there something that is going on? Is there something that I can do that I can help you? And with that, maybe the person will feel like that there is a chance to have more support from others.
Okay, so we talked a lot about postpartum depression, but when we started our conversation, there was mention of like anxiety and disordered eating and maybe OCD also presenting alongside with postpartum depression. So how can we look out for those like symptoms, anxiety, or even OCD? Like I think like it's OCD is something that like I've never really thought of for myself, or at least when I was younger. But then as I learn more about the symptoms, I'm just like, oh, maybe I am a little bit like particular about how I do things. And so, yeah, I'd love for you to speak a little bit more about that overlap with anxiety and OCD and disordered eating and how that can present.
Yeah, of course. Sometimes, when we have like a mental health condition, it's not isolated. Sometimes can come with other comorbid condition like anxiety. So sometimes, especially depression and anxiety can coexist, and sometimes the depression can be expressed or manifest as a weight of anxiety. And sometimes when you have high level of anxiety, it's exhausting, and that can lead into depression. So sometimes they coexist, and you have to work on both pieces at the same time in terms of treatment. In terms of eating disorder, what we have or we know is that eating disorder exists across the lifetime of a woman. And if you have an eating disorder, eventually maybe you wanted to have a baby, you get pregnant, the eating disorder will not necessarily disappear because you are continuing living your life and living different stages of your life. So sometimes we can have a patient who maybe take like a break, if we can say that, and because they know that they have to take care of the baby, and maybe make a pause of the eating disorder, but the eating disorder is still there. And then when they have the baby, the eating disorder can come back. And also during the pregnancy, you have many changes on your body, and that also can trigger more the eating disorder because you're gaining weight and your body is changing, and that increases the body image issue. So I think that what is important is, no matter if it starts as an eating disorder, no matter if it is like starting as a postpartum depression, perinatal depression, is that if you don't feel good, it is important to seek professional help. Sometimes I say that your primary care physician, especially in our community, is our safe place. It's the person that we feel comfortable because we have a relationship with our PCP. Is the patient that is the person who maybe you have like a longer relationship as a physician, and that could be the first step. The first step is just like sharing, this is how I feel. Maybe it's a physician who knows you better and can see some changes, and by sharing your experience, the physician can help you to identify if you need professional help. As soon as you can receive that professional help, the better, because you will have the support, and you don't need to suffer by yourself. You don't need to feel that you have to suffer the depression, taking care of your baby, and trying to fit all of the issues from your family. I think that is important to, as you mentioned at some point, in order for me to take care of my baby, I need to take care of myself. Sometimes I have some patients having this difficulty time thinking that taking care of myself is not selfish. And I say, no, because if you are not okay, your baby are not going to be okay.
I love that. Thank you for sharing. I always like to ask my guests what advice they have for the next generation. I think while this podcast is geared towards people that are millennials and in that age range, there are a lot of us that are looking to help the next generation, whether that's our kids, our nieces, nephews, or if we're in the education system, students. So what advice would you have for the next generation? And it could be pertaining to what you do or just life in general.
Balance. I think that finding balance in life. I think that sometimes, I don't know, we get obsessed with many things that don't give the balance that we need. And finding the balance is the healthy place. Whatever is the balance for you.
Yes, I completely agree. And it might take a while to find balance. But once you find it, you're just like, yes, this is good. Thank you so much. This has been a great conversation with lots of knowledge. I am so thankful to be able to speak specifically about postpartum, perinatal depression, and the things that we should be looking out for so that we can help ourselves and help others as well. I'll be sharing all the links and the websites where people can connect with you and especially get connected with the study with the MomGenes that you're doing. And I hope people do consider applying and seeing if they can help, because we need more representation and more information and knowledge from our communities in order to help, like you said.
Yes, I think that with a small sample you can help other moms. Thank you for the invitation.
Yes, thank you so much. This has been great, and I look forward to connecting with you again and hopefully meeting you in person sometime. Thank you.
Thank you.
What a wonderful and honest conversation that is sure to keep raising awareness for our community. Thank you so much for listening. There'll be one more episode next Tuesday as we close out season 12 and take a break for the holidays. So after you listen, feel free to take a screenshot to post on Instagram and tag @elevatinglacultura or send me a DM. You can also comment on our YouTube video if you're watching online. I always like to hear from people and how they resonate with the stories I share. So leave a review on Apple Podcasts so we can get more ears listening to these stories and we can continue elevating la cultura. All right, enjoy the rest of your day, afternoon, evening, whenever you're listening. Y nos vemos next week. Bye.